All right, hey, what's up, guys? I'm here with Frank and Shannon. We're going to be reviewing what makes a physical therapist like Shannon excellent and what would make a physical therapist maybe not the right one for you.
Super excellent.
Super excellent.
Yes.
We have the best.
Super excellent, yes.
We have the best. We're going to be reviewing a video and cutting it in a couple different aspects to break it down.
The evaluation process. This is when your physical therapist should be diving deep into understanding you and your specific condition. This is the time where you and your physical therapist need to work together to chart the best
Work
course of
together.
action. Based on this collaboration, a
Agreed.
good physical therapist will prioritize creating meaningful, individualized goals that are specific to you. This
Unfortunately, in a lot of settings, right, they just don't have the time. There's not even a bad therapist. It's a bad situation where you only have maybe 15 minutes to do your entire evaluation.
Yeah.
So taking the history and trying to perform a physical exam and make a plan, it's almost impossible in that limited time.
Unfortunately.
Right.
And that would have to do with being reimbursed by insurance, right?
Possibly, yeah. Unfortunately, a lot of settings, because the reimbursement for physical therapy is fairly low,
Mm-hmm.
you have to run your business by having a high volume of clients.
Physical therapist will likely rush through the talking portion of the evaluation. It may not even ask you what you're looking to get out of physical therapy. Therapists that breeze over this part often offer a generalized one-size-fits-all approach, which can significantly limit your outcomes. This not only impacts the customizability of your treatment, but also impacts the therapist's ability to track your progress, because the goals are not meaningful and not reflective of why you were going there in the first place. You might feel like you're going through...
I could speak on this real fast. Usually what I do with my new patients is I always ask them what their goals are.
Mm-hmm.
So that it's outlined. What are your major goals? Really try to define it very specifically, because then you can always go back and you can say, okay, it's been 3 months, it's been 6 months, it's been a year. Have we addressed these goals, the main things that you came and saw me for?
Right.
So do you do something similar when you see patients? Or?
Yes. Yeah, and in particular, I feel like we see a lot of unique athletes, right? Figure skaters, bodybuilders. I had a time period where I kept seeing teenage fencers, or is that what you call someone who does fencing? But I'm like, I know nothing about fencing. Like, I had to go research videos on fencing, and who knew there was so much asymmetry, right? Like that front leg is huge. But trying to learn about the specific skills and athletic endeavors, whatever that they need to improve, like a spiral and figure skating. Again, sometimes I have to learn something totally new because I don't know every single athletic move.
Yeah.
But trying to figure out how to address their specific goals for their performance, or obviously for pain and injury, but sometimes it's for a higher level performance aspect too.
I think a lot of times what I do with my people is I'll just ask them too, like if they're trying to lose weight or do whatever, I'll just ask them, okay, have you had done something in the past that's worked for you?
Mm-hmm.
That's a good question to ask. Like, the same thing. Both.
What have you tried so far?
What have you tried so far? What has worked for you? What has not worked?
Right. Yeah. So we're not running down the same road that you already went down that was unsuccessful.
Yeah,
sometimes.
because everyone's different. Everyone's going to be a different way for sure.
The motions without a clear sense of purpose, making it difficult to stay motivated and committed to the process. How you can ensure that you're receiving individualized care that is directly related to your goals is to ask the therapist to see your goals that they have written down for you. If they are generic goals that seem random, frequent and continuous assessment of your progress is absolutely crucial to ensuring that the treatments you receive are effective and on the right track. A good physical therapist understands the importance of regularly evaluating your response to treatment and will make necessary adjustments to optimize your progress.
What is some of the frequency that you use when you see patients?
I think, as with everything, it really varies a lot from person to person, right? If they're in sort of an acute state, I might be reevaluating a little bit more frequently. If we're on a longer term plan, that will probably spread out, right? Depending on what their specific goals are, how many things we have to change. When it comes to, say, walking, like just gait, quality of walking, stuff, that's something, you can reassess that every time when you see them walking in the door, right? Like, that's a fairly easy one. Some things I'm just looking constantly as they're getting in and out of the chair, how they move around, getting up and down from the table, basic things like that I look at every single time, honestly.
And it makes them keep motivated too. If you say, hey, look, this is where we started, this is where we're at now. That's great progress. That's what keeps them motivated to give the frequent evaluation,
Yeah,
for sure.
absolutely.
Yeah.
If they're kind of paying attention to the same things
Yeah.
I'm paying
Mhm.
attention to, that makes it easier for people to buy into. Yeah.
Now, would you say more frequent would be like once a week, twice a week kind of thing?
It really truly varies for
It
each
varies.
person because in my particular setting, like being a cash-based provider, I don't see a lot of people for long-term like surgical recovery, right? Because it would be cost prohibitive for a lot of people to do that, right? So most of my folks are spread out a little bit more. They're
Okay.
either some kind of a chronic condition management, or we're touching base and they're doing a lot of their work at home. So we may reevaluate almost every time if they're doing most of their work on their own and we're just touching
Gotcha.
base every couple weeks or once a month. So yeah, it just may depend on how often we actually have our visits.
Wait, are you saying that recovery from surgery, would that be like a weekly thing? Would that be more high frequency?
Probably, yeah. Yeah, so like if we are needing to meet certain criteria as far as restoring range of motion,
gotcha.
strength, ambulation, walking, yeah, those things would require more frequent assessment.
A sign of a good physical therapist is one that is constantly monitoring your progress. They frequently engage in open discussion with you, asking about your experiences and any.
Sorry guys, I gotta cut short. I gotta
No,
go
you're
there
fine.
to That was a good start.